Mr. Kendall, Dr. Vangsness, good morning. It is the 15th of May, 2013. We're at the USC Keck School of Medicine Outpatient Surgery Center at the University Hospital. Here's the anterior cruciate ligament, the crossing ligaments. Here's your posterior cruciate ligament. These are the two crossing ligaments in the center of your knee. Here's the femur, the arch. Inside compartment where we have some problems, I want you to see right away a little bit of cartilage change right there. It's not nice and smooth right here, a little rough. Here's the front part of your meniscus. Now we look to the outside. You can see the front part of the meniscus, the outside compartment right here. You can see how pretty that cartilage, that's nice looking smooth cartilage. Get a little light in here. Good. And a white balance too. All right, so this is the outside compartment. Nice looking cartilage right in through here. I'm going to straighten the knee out. Now, as you can see, we slowly straighten your knee out. Straighten it up, and you can see here's your kneecap, the patella. We talked about that before the surgery, and here's my little probe. You can see that looks absolutely terrific. Look at that. Nice and smooth. Here, of course, is the femur at the end of the femur. Looks absolutely terrific. I will say, quite frankly, it looks youthful, looks terrific. I'm very pleased. Now we come down to the inside compartment where we know you get problems and maybe some not so youthful changes right here. You want to take my left side? Okay, you can see here's your meniscus tear right there. Here's your rough surface of your femur. Okay, so here is the meniscus. You can see the tearing meniscus right in through here. Kind of hides and goes back into this direction. Right, you see I'm falling into that tear. We're going to trim that back. But appreciate you got a little bit of a, I call it cobblestone right here. Straighten the knee. This is what you're walking on right here with your knee fully straight. So this is advancing arthritis. Wouldn't it be nice to glue that or spackle that? It doesn't work like that. This is degenerating. So you have two sources of pain. One is this articular cartilage on the inside, and one is this meniscus tear. Have the ductbill to me, please. Thanks, Lisa. All right, so I'm going to put this large instrument. It looks like it's about 3-4 millimeters in size. Pull that cut right there. First pass. Shaver to me, please. This is that tough fibrocartilage. I'm trimming that back. Put a shaving blade in here now. This is just to give you dimension. This is 4 millimeters in diameter. So everything is quite large. What I'm doing now is just kind of smoothing this taper, doing this we call a partial meniscectomy. See, this is back where it goes horizontally through here. Good, almost done here. This is again, the inside compartment, the medial compartment. See, I don't know if that's going to tear into him or not, you know. Give me the ductbill. I got it. Straighten the knee, good. See how torn it is back there further, behind there. Darn it. We can see it once we get this back further, just like the MRI shows us, there's a lot more tearing deep in there that was hidden, that would break through. This horizontal cut right there, you see. whole cracked and fissure. We'll just take this back. There we go. Can I have the RF next? Good. All right, so we're roughly done now. I'm just going to come in here with my radio frequency device and trim this back to a stable rim. So now, but basically what I've done is just smooth out and taken away all this torn, complex tear. Straighten the knee for me. We'll kind of smooth this interface down now. Straighten the knee. Excellent. Beautiful. Terrific. I think we're nice and smoothed out now. Shaver? Thank you. Thanks, Lisa. All right, so now we've fixed out that torn meniscus, put a nice smooth interface. Terrific. Probe to me. Focus a little bit. Good. So now this is the inside meniscus, the medial meniscus. We've trimmed this out to a nice stable rim now. Looks great. As we take this all the way out here. And this is obviously the posterior half. Here's your front half of your meniscus, so it's that back half. This is stable, but appreciate now some rough surfaces on the tibia. Look at that rough surface on the tibia right here. Rough surface on the femur as you bend it up and down here, bend slowly up and down, and that's what it looks like. That's your arthritis. We took care of that meniscus pain. All right, let's go back to the top part where the patella is. Watch my foot. Good. Kneecap looks great. Let's go to figure 4, the outside compartment, and we're done. Now we'll go to the outside compartment. That was the inside compartment we were just in. There's that good ACL, and look, this is what it should look like. Look how pretty that meniscus is. Nice, and got the normal flounce there. Look at that. Now, a little softening on here, but you can see a little more of a dome over here. And this is soft cartilage. Looks nice and pretty smooth right across through there. Looks pretty good. Here's your anterior cruciate we talked about. Here's the femur. Look how smooth. That is a wonderful, very youthful looking area. Shaver to me. And we're done now. So we've done the inside meniscus. We looked at the patellofemoral joint. We looked at the crossing cruciate ligaments. And now we're in the outside compartment, the lateral compartment, and that looks just very youthful, as I'll dictate. Want to hit the back of the knee a little bit for me? Good. So that's what a good compartment looks like. Good femur, good tibia. That'll be all from the Keck School of Medicine today. Thank you very much, Dr. Vangsness, as we look at your anterior and posterior cruciate.